We welcome again Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital. Thanks for joining us tonight, Doctor.
Thank you for having me.
So, Dr. Hassoun, we're learning about new positive cases among students all the time, including a new one at Fayetteville High School just within the last hour. So with the winter months coming, it could get worse. We're concerned, or how concerned are you about the spread of coronavirus with students back in the classroom and playing sports?
So I can tell you for sure we're going to see increasing cases. We already have seen with the change in weather actually increasing cases. And it's expected as the weather gets colder, people going to stay more indoors. So there's more chances of transmission. And with that, we're probably going to see definitely between schools, other workplaces, more cases there. So it is concerning. I'm hoping we're going to push more toward the prevention and follow the guideline as much as we can so we can reduce as much cases as we can.
Dr. Hassoun, as we just mentioned with Rogers School, a big issue that schools are facing are the number of teachers and staff members in quarantine. Schools are switching to virtual learning for several weeks at a time to let the virus run its course and then returning to the classroom. So is that enough to actually get the virus under control in a school?
Yeah, I can tell you, I know they've been trying where they close it for a few weeks. My opinion concerned that it's really very hard to control it in a week or two. Yes, you might be able to cut down on it, but it will be extremely difficult. I think it's gonna need to be 4 weeks at least to make sure the transmission, tracing and tracking others, make sure other cases won't show up. So 2 weeks is not gonna be good enough because imagine exposure happen. It takes about a week or 10 days for another case to happen. So it's gonna take time. So 2 weeks is usually not enough.
So what kind of a disservice is this to kids? I mean, what are the health ramifications of switching back and forth between in-class and virtual schedules? And not necessarily just for the kids, these poor parents. The stress levels must be off the charts, and this can't be good for anybody.
Absolutely. It's very, very challenging, Dan. And that's why we said from the beginning, we need to really have a plan of how we manage this. We need to get to a low level of transmission as much as we can so we can comfortably open it up and then reverse as things go. By going back and forth, it's really, really challenging and stressful for everyone, whether the kids, education, the parents, how to deal with it, what to arrange, can they be off work? It's very, very difficult. I really think, especially as the case is gonna go up more, we're gonna need to rethink this and going virtual till the end of December rather than keep back and forth with this. So the parent at least and the kids know what's gonna happen in the next 8 weeks rather than keep back and forth.
Dr. Hassoun, states across the country are seeing a surge in coronavirus cases. Many health experts are concerned about a second wave. One even said that we could see a rapid acceleration of cases starting as early as next week. So how concerned are you as we see an uptick in cases across the U.S.?
Yeah, so I can tell you now, my main issue with this, we really never seen the first wave go away completely. We've seen improvement, definitely, but we never see it completely go down to a baseline of only 10 cases or 5 cases. So the first wave is still ongoing. It's the upstick in it and the increase in it that's now coming up as we see it in the hospital, as well as we see it in the community. It is, again, the community gonna be able to help us if they follow the guidelines so we can limit the transmission, we can limit the numbers. And that's really gonna be helpful rather than we'll see significant increase and it will be very, very difficult to manage for everyone, community, healthcare facility, for everyone.
Certainly don't want to see any more hospitalizations tonight. We know there are 135 coronavirus inpatients across your Huntsville hospital system. 36 of those are at Decatur Morgan Hospital, and that's one of the highest totals that facility has ever seen. And it's, we learned, is expanding their intensive care unit and coronavirus facilities. But how else do hospitals respond when they see a rapid spike like this?
So, and you know, we've faced it initially and we've had planning in the beginning in March and April for changing, for example, adjusting to that increase by getting different floors to be a COVID units floors. ICUs get to be changed where we reserve it only for COVID patients. We make sure going to be enough ventilators, make sure enough PPEs. So there's been already planned ahead of making sure if we see increase, we're going to be able to absorb it. Now, how much we can keep on with that, that's the question, because it depends on how many cases going to happen. And it's not only these things, it's the staff, you know, between nurses, environmental services, secretaries, everybody will get affected if they get sick. So there's going to be shortage. So again, we hoping everybody work together to be able to cut down on the cases as much as we can.
Huntsville Hospital CEO David Spiller says 80 hospital employees are home from work due to the virus. He says it is impacting the hospital's ability to treat patients. So at what point does this put a very serious strain on our hospitals?
Yeah, I mean, if this will, where we're going to see more increase, definitely it's going to put significant strain and challenge, because, you know, these COVID unit, we had nurses who's trained in management COVID patients. We have nurses now who had experience. The same goes for every level of staff, you know, dietary services, environmental services, secretaries. So if we get shortage in that, it's gonna affect how much care happened to these patients, how we manage these patients. And as you'll see more infection, it's gonna affect also families of these healthcare staff. It's all like a domino effect. So it really can put a strain and challenge if we see significant increase.
Well, still ahead, we have a lot more to discuss with Dr. Hassoun, including the search for a vaccine for coronavirus and a newly authorized treatment.
Stay with us. You're watching WAAY 31 News at 6.